Hello guys, my name is Aline, I'm from group 10 and I'm going to try to summarize this case and expose some of my thoughts about it. This case is about Professor Garden and his team trying to find the best way to run a trial using a new medication to psoriasis. They are considering all the possibilities since they have a limited funding for 80 patients. The first option was to run a parallel trial comparing the new drug with placebo. Despite of being easier to evaluate results and use of powerful statistical methods, they were worried about the use of placebo. They think that it might be unethical since there are other available treatments. In my opinion, this is the best way to test this drug because of the advantages I mentioned before. And about the placebo, I don't think this is a problem because psoriasis is not a deadly disease and the available treatments are not fully effective sometimes. The second option, comparing with methotrexate, would lead to some problems as well, concerning especially the blinding, and because they would have to use two placebos, making the study more costly. Other options considered for this study were designs using multiple comparisons. For example, making a 3-arm study, comparing the new drug with the standard therapy and placebo. And in my opinion, it is not a good option because of the loss of power. They also consider to run a crossover study, but for me, in my opinion, it's very complicated because of the carryover effect that can affect seriously the validity of the study. The drugs could have a long washout period or modify permanently the disease. That's why, in my opinion, it is not a good idea as well. Finally, they talked about to run a factorial design, a study with factorial design, as it carries out multiple comparison and could also compromise the power of the study. It's the same rationale of using multiple arms. The more comparison you make, the larger the sample you should get. And if they want to evaluate the interaction of the drugs with this design, they should increase the sample size to increase the effect as well. So in my opinion, the best option for Dr. Garden is to run a parallel trial with 2 arms comparing placebo with the new drug. Thanks.